DDW is making headlines. Let's hear from some of the researchers presenting their groundbreaking science here in Chicago. What are the key takeaways from your research?
Well, the first one is that there has been a gradual decline in colorectal cancer deaths over time, with corresponding increase in deaths due to other causes, which is always an encouraging trend because it reflects better diagnostic facilities, better screening, and better management strategies for colorectal cancer. The second key takeaway was that young patients with colorectal cancer are more likely to die of their colorectal cancer versus older people who are more likely to die with other causes. So the disproportionate deaths due to colorectal cancer in younger patients is really concerning. And recently, U.S. Preventive Task Force has reduced the screening age for colonoscopy in average risk patients from 50 to 45 years, which is, we believe, is a step in the right direction.
What is the key takeaway from your research?
So the key finding from the review that we did was that being breastfed, having a regular and higher vegetable intake, and owning pet, making sure the antibiotic use is judicious, and avoiding three factors, that is passive smoking, Western diet pattern, and not being excessively worried about hygiene can minimize the risk of pediatric IBD.
So what does this mean for patients?
So I think the key takeaway for patients is that if you have a family history of IBD, maybe you can start to practicing some of the modifiable factors, so looking at your diet, making it healthier, and avoiding passive smoking, especially for the early childhood years if possible.
We're investigating a treatment which is an endoscopic procedure treating the first part of the intestines, and it's a treatment for type 2 diabetics. And we investigated in our specific study if we could eliminate insulin completely in patients with type 2 diabetes by giving them a single endoscopic procedure and another medicine.
How will this better patient care?
Well, insulin treatment is, of course, it treats the symptoms for type 2 diabetes, but it also induces weight gain and has a negative effect on the overall metabolic health of patients. So insulin is not the way you want to go, and that is a symptomatic treatment of type 2 diabetes. And now we have a potentially effective treatment that treats the actual root cause, being insulin resistance of type 2 diabetes.
These groundbreaking discoveries are paving the way for better patient care.